Hello, dear colleagues. My name is Mynzhylky Berdikhojayev, and together with my assistant, Sheikh Shurikhanovich, we are from Almaty city, Kazakhstan country. It's in the Central Asia, and today is 31st of May 2025, and it's a great day. My brother Adilbek was born today, and I want to say to him happy birthday. And for today we planned 8 cases. The case number 1 should be aneurysm case, but we replaced because of the morning and the organization for general anesthesia. Usually in the early morning takes some time. That's why the first case is stenosis. Patient had a stroke 2 months ago in left MCA territory. On the right side, slight stenosis. It's not the indication for the treatment. Patient had a coronary bypass in 2017. Has a diabetes mellitus and arterial hypertension. Usually this kind of patients comorbid and with multifocal atherosclerosis, and cavernous segment of the ICA starting from the petrosal segment is stenotic. It's a long stenosis, and this story usually will end with the ICA occlusion, and in couple of months this ICA will be occluded, and usually the patient will experience severe stroke. And from this segment till this segment, I think we need to place a stent. Yes, unfortunately, nowadays it starts to be impossible to treat this kind of patients with the governmental support, and they should pay for the treatment. The insurance system now excluded these patients from the insurance. It's drama, and the patient is need to pay too much money, and yes, on the left side the vertebral artery was occluded. Okay, now we will go to the left ICA territory, and for the ICA stenosis in proximal part we will place exact stent. Exact is better in my experience, but with this angulation it could be shift of the angulation distally. Maybe carotid wall stent will be better. Let's see. And for the upper part we will place several coronary stents, and this part is more severe stenosis. Okay, let's measure. Бақыт, коронарщиктерден 3,5 деген стенд, кеше Onyx Trustar деген бар. Мынандай. Just a second, we are discussing with Бақыт. Подожди, бар екен. 3,26, 3,15 как раз. Okay, we have a 3.5 mm stent. 18-40 болатын шығар. Вообще мен ойлап тұрмын, может быть, той жерге не қоя саламыз? Wall stand қоя саламыз. Yes, maybe we will place a carotid wall stand. But it's last carotid wall stand. That's why maybe cigar, but cigar is in angulation, then it might be problem to take out the protection device. Okay, wall stand is better, but okay, let's place wall stand. Ашыңыз. Yeah, ашыңыз. Прондар ашып тастадыңыз ғой? Okay, we will place a carotid wall stand. Баллон 4,5-20 шашырмыз. As on Monday, we are planning to live stream 2 cases for Link in Paris. The first live case will be from Almaty. It will be in 8 in the morning, and second case will be at 10:30. And for us, it's a good opportunity given from a Link team, from Professor Moret and Professor Laurent Spel, and my old friend Vitor Mendes Pereira. Arka tartasans. Okay, for the stenosis we can use the second screen. The name of the screen is Link live transmission screen. Okay, let's do it like this. I think this is better for the stream. Yes, I think it's better. This is select.
That's fine.
Contrast.
Contrast?
We need some contrast. Yes,
Contrast?
and I think my myopia is now changing for
Contrast.
0 and maybe hypermetropia. That's why I have some problem with my visualization. И стенд 3,5 дегенді ашып түсе беріңіз. Қимылдамай жатыңыз, жақсы ма? Patient under local anesthesia. Не шевелитесь, пожалуйста. Я 3,5. И 3,26 ашып түсе салыңыз. We'll place 2 stents in cavernous petrosal segment. Okay. This is 4.5 millimeter. I think we need to do pre-dilatation because it's a wall stent. Sure. Okay, as usual, that's a problem. Huh? Неге боковых істемей тұр? Assist machen. Okay, it works. It works. I will do it like this. Okay. Now, reference 1, reference 2. Okay. Біреу 26, біреу 15. Старайтесь не шевелиться. Хорошо? Не шевелимся. Лежим, не шевелимся. through Xeon blue wire, which is 14 system. We will navigate the pronder. Because of the angulation, it's very useful to work with the 14 wire coronary. It's also possible to use something like a Texas or a regular Xeon, but for me the coronary devices is specially designed for the stenosis, and the balloons, angioplasty and protection devices are mostly made for the stenosis, and I think they need more support. Yeah, mozak. We have mozak. No, yes, and Shaykhnet is mostly microsurgeon, that's why there is some technical points, huh? Shaykhnet. Microsurgery is very good, huh? Так, пульс қанша? Пульс қанша екен? Yes, we don't see the pulse.
Пульс 65, сатурация 100.
Okay. Атропин салсыншы, 1 кубик. The pulse is less than 60, less than 70. That's why I asked for the atropine. 1 кубик atropine. Yes, yes, in Kazakhstan, the endovascular neurosurgery, not interventional neuroradiology. Urliver, Unica. We will give a nominal pressure, which is 12 atmospheres. Назад. After stroke or prostata. Patient has a epicystostoma because of the prostate pathology. Еще раз, Вадик. Yes, the ICA is mobile. Назад. ICA is mobile, and during the angioplasty, the arteries became straight, but it's also the... Все, спасибо. Гепарин кеттой, да? 1 кубик стисанс. We asked for 5,000 international units of heparin, and now anesthesiology team is giving atropine. We decided to place carotid wall stent. It's the last carotid wall stent on the shelf. I hope the intracranial venous stenting will be later, not in this month. It's also the problem. Okay, now we will place the stent in the artery, then we will do check angiography, and after that we can start to open. The angulation could move distally. It's a problem of the IC. Now we can straight the artery. Okay, I think it's a good place. It's okay, it's okay. Now we start to open. The stent is very good visible. There is no question with visibility. Okay, now stent is opened. Yes, and you can see how much is changed the anatomy. Okay, I think the post dilatation is not necessary. Artery is with good diameter, has a small angulation distally. Might be this wall stent is quite stiff stent, but I think it is well opposed, and it was a 930 carotid wall stent. Okay. Because of the elongation, yes. Because of the proximal stenosis, sometimes the distal part diameter is becoming smaller, but after opening the proximal part of the artery, the distal became in a regular size. Okay, for the stenosis we can use this screen, and it's not so much problem. Yes, we can show it, no problem. Yes, now we'll take a Zion blue. Skärm bestämt skär. Yes, it's a new version of Resolutonics. The name is True Star, Onyx True Star. As we used yesterday, the first one. I think in Uzbekistan we still use Resolutonics, but this is Zotaralimus eluting coronary stent. It's a new version now. Yes, and you can see the difference between those stents. Okay, I think for this indication we can, this part of the treatment we can use the lateral view, and thanks to Flex Vision from Philips angio system, we can do it. We can do it easily. We can change the adjustment of the monitor very easily. Okay, now we are inside the wall stent, and it will give more support. I think the aortic arch is a little bit difficult. Yes, in this anatomy sometimes we need to place the micro distally. Yes, on AP I can see the position of the. Yes, now I think it's enough, huh? Okay, let's do angio. Just a second. We can place it here. Then I can do angio. I hope the stent position is okay. Yes, it's a little bit distal, but it's okay. Then we can place second stent proximally. Смотри. I will pull a little bit, just 1 millimeter or 2. Now we can give first of all 7 atmospheres, which is 3 millimeter. The remaining part of the ICA it's okay, it's 12 atmospheres. Now you can deflate. Okay. We deflated the stent. Yes, the visibility is less than in wall stent. Yes, wall stent is much more better visible. Okay, the stenosis is resolved now, and now we will place the second stent. Okay. Okay. The second stent will be a little bit longer. The first one was 3.5 by 15, and the second stent will be 3.5 by 26. The navigation of the longer stent is usually a little bit difficult than the shorter version. I think now we can take out the roadmap. We don't need roadmap, and we will replace the AP. And now we can give more zoom to be sure that the stent is in correct place. Oh, it's okay. Now it's placed in correct position. Okay, Onik. I'll give 12 atmospheres, and maybe we will need a stent number 3 in the proximal segment. 1/3. Okay, назад. We gave 14 atmospheres, which is 3.6 millimeter. As the proximal part a little bit stenotic, but I think we can place one more stent, which could be a little bit bigger, maybe 4.5. It looks like there is some kind of dissection, but it's possible after balloon dilatation. It's possible. We will adapt both stents in the segment with the 14 atmospheres. Okay, stop. Okay, назад. Yes, now the stents are in size 4.6 millimeter. I think we need to ask for one more stent in proximal part here. It's a quite interesting experience with the drug-eluted balloons, but there is some technical parts with the insurance system. No? Okay. Бақыт. Бізде не жол екен? 4 деген жол екен. 4 шарм 9 бересіңіз. The next stent will be Ultimaster Nagomi. Yeah, sure. Ultimaster Nagomi is 3.5 by 9 millimeter. Келесі пациентқа келе берсін. Yeah, мочевой керек. The next patient will be in general anesthesia. That's why we are using full red. Рома, у нас все нормально? Все нормально? Окей. I hope you could hear me because the battery was empty, and now you can see. Yes, this kind of treatment with some tortuosity in proximal part after placing the wall stent, the artery distally became a little bit angulated, but I hope it's not problem. Who has experience with the carotid wall stent can do comments, and I think it's okay. Yes, some contrast is around the stent, but it's remaining part of the artery with the stenosis, and usually it's not problem. There is no extravasation in cavernous sinus, there is no CC fistula, that's why we can finish this case. Now I will ask Shaykhmet to do control CT. Oh. Как чувствуете себя? Хорошо? Разговариваете? Как вас зовут? Не говорите. Хорошо. Рукой пошевелите правой рукой. Хорошо. Ногой правой. Ой, не так сильно. Все, хорошо. Окей. Звук можно. Oh, Есть, да, звук? Okay, dear colleagues, it's a protocol after every intervention for the future security. We are doing control CT, and control CT is clear. Now we can finish this case, and I hope to see you in next 30 minutes. Next case, patient with ICA and ACA 2 aneurysms. In general anesthesia. Hope to see you. Okay, thank you for watching. See you. Все, можно заканчивать.